Okay guys, so I'm going about by the Rosebowl here, and they got some event going on, and I'm not exactly sure what the event is. Obviously some running event, and it kind of goes to show, it's kind of funny when you ask the people that are providing like security or event organization how little those people know. And I want to take you there. How much do we really know about our surroundings and about anything when it comes to the details of, let's say, this sport, running, and or the purpose of being at an event and why you're at an event and so on and so forth. And obviously there's a very common general interest. People just want to run, and they like running, and they like fitness, and it seemed like a good thing to do. They maybe Google search. I forget what I used to use before, but there was a app that I used before that you could search any event and even buy tickets and get information on that event. So I forgot what that was, but I used to do that a long time ago. I don't do events right now. And then there was those event people that signed up and used that service and connected their ability to pay for those events and enter those events through that app. But that's neither here nor there. The idea, what I'm proposing here, and what I'm experiencing, and I'm sure you're experiencing here, is everybody has a very limited view and limited knowledge about what goes into the whole thing, what goes into the entire process of anything. And you get people that, like for instance here, they're going to come and run, or come and watch their family run or their friends run, and want to be a part of this, and are enthusiastic about the fact that they can run and do things. And everything has been marginalized and kind of siloed to the fact that nobody really has the bigger picture and the overview of everything, and they don't even pass that knowledge around to the higher, to the everybody involved with that project, from the person that is promoting and doing the whole project down to the person that is providing access to where to park for that project or that event. And that's kind of what's happened in other aspects of things when it goes to where I work in healthcare, and nobody really understands how things work with their benefits and their coverage, and to the fact of, it might be something basic like how to get a doctor's appointment, and if it's a urgent or a routine appointment, to how to get an elective surgery or a planned surgery that your doctor feels that you need, and how that whole thing vets out. And I live in that world. I live in that world as an RN and as a manager of hospital case management, and I see that very being very detrimental to that patient and their family and everybody involved with the care for that patient and their condition. And that's how it got to, my aspect of things at that time is managing their admission and making sure everybody's on the same page when it comes to how they're going to be cared for and follow through care and so on and so forth. And it's very, very fragmented, not only from the hospital standpoint, but super intensely fragmented from the health plan coverage and provider network coverage standpoint. It's a literal clusterfuck of broken information. I can't put it any nicer, you guys. It's screwed up, and I have to live in that world because that's what I'm paid for. And I solve those complex issues. But it's something that we've allowed government and big business, meaning big health plans, to keep in this screwed up fashion for decades, and with no rhyme or reason other than they're going to get more profits if they make things more complex. I mean, that's the only thing I could think of. And they don't care that at the end of the day, the people that it's affecting, the people that it's hurting, even though we know statistically the number one cause for bankruptcy in America is medical debt, yet we have no politicians that have the balls to change things and to do things to make it better, to prevent that and help the working class have true healthcare coverage that actually is easier to navigate and actually provides proficient healthcare care planning and so on and so forth, all the collateral things that you would think of involved with healthcare. And I'm sick of it, you guys. I'm really sick of it, and I'm hoping that we can get rid of people like Adam Schiff and get rid of people that are in California politics that have been screwing things up, all the way up to the governor. I'm glad his term is ending. I don't think he has a clue about healthcare. Neither have the previous governors for California for years. And honestly, it's been screwed up, and I'm hoping it changes. So I'm going to leave it at that as I climb up this hill and get onto my mountain bike ride.